Welcome to the Heart of Connection. Today we're going to explore a particularly complex and challenging issue: building trust in children with reactive attachment disorder, or RAD. These children who have deep-seated trauma that prevents them from forming healthy, secure attachments to caregivers and sometimes to anyone at all. Children with RAD often display behaviors that can be difficult to understand and even harder to manage. The process of building trust with these children can feel like an uphill battle for parents. But trust, as we know, is foundational to any relationship, especially when it comes to healing trauma. In this episode, we'll break down the different types of RAD, explain how trauma affects trust, and discuss the ways parents and caregivers can navigate this challenging journey. We'll also explore the importance of empathy, patience, and maintaining your own emotional balance while working with a child who struggles with attachment. First, let's talk about reactive attachment disorder itself. RAD typically develops in children who have experienced severe early childhood trauma. Things like neglect, abuse, abandonment, or inconsistent caregiving. This trauma interrupts the child's ability to form secure attachments, which are crucial for healthy emotional and psychological development. Children with RAD often exhibit a range of behaviors that reflect their deep mistrust of others. But what makes RAD specifically difficult is that these children may be dealing with what's called pathological trauma processing. Here's an analogy that might help. Think about physical pain. Normally, if you stub your toe, the pain goes away relatively quickly. But in some rare cases, people experience something called phantom limb pain. Even though the limb no longer exists after an amputation, the brain continues to perceive pain. That pain can feel more intense than it should, and it doesn't make sense to the person experiencing it. In a similar way, psychological pain in children who have suffered trauma can be processed abnormally. Their emotional pain, instead of being resolved or healed in a normal way, gets amplified, distorted, and sometimes misdirected. This is why children with RAD may react to situations in extreme ways, often making it feel impossible to connect with them. Let's break down the types of RAD behaviors that you might see in these children. There are generally 3 different patterns that emerge. The first is the clingy type. These children might have an overwhelming fear of being abandoned. They can't bear to lose sight of their caregiver and might become incredibly codependent. They often demand consistent attention and reassurance. And when that attention isn't available, they may spiral into anxiety or distress. This type of RAD comes from the child's belief that if they don't maintain consistent proximity to their caregiver, they might lose them. And that's a terrifying thought. Next, there's the volatile type. These children are often challenging, defiant, and can be explosive in their behavior. They may demand absolute attention, refusing to let their caregiver focus on anything or anyone else. The volatility in their behavior is a sign of the emotional pain that they are experiencing. But it's also their attempt to maintain control in an otherwise chaotic and painful world. They may manipulate situations to keep their caregivers in a heightened state of vigilance, because this is how they've learned to get their emotional needs met. Then there's the chaotic type. These children tend to create chaos wherever they go. They may stir up drama, cause disruptions, or engage in unpredictable behavior. This is another sign of their attempt to cope with internal pain. For them, the world is often a chaotic, unsafe place, and their actions reflect this constant state of emotional turmoil. They may not even be aware of how their behavior affects others. They just know that their pain feels uncontrollable, and they express it outwardly. So what can parents do when they are faced with these behaviors? It's crucial to recognize that these actions are not about you as a parent. They are about the child's trauma, and their inability to process that pain in a healthy way. This is where maintaining your own emotional equilibrium is key. Children with RAD are often not thinking in a straightforward manner. They might lash out, withdraw, or demand attention in ways that feel personal. But you can't take it personally. It's essential for parents to develop some level of emotional detachment. This does not mean you stop caring. It means you don't internalize the child's reactions as a reflection of your own worth as a parent. When you can remain calm and composed, it's easier to handle the emotional turbulence that comes with RAD. One of the most important things you can do is approach these children with empathy, but also with patience. Empathy isn't just about understanding their pain. It's about giving them the space to process that pain in their own time and on their own terms. If your child is having an episode of distress or pain, don't try to force them to connect right away. Instead, explain in simple terms that you're there for them when they're ready to talk. You're not leaving and you're not abandoning them, even if they're pushing you away. Let them know that you see their pain, but that you'll be waiting for them when they're ready to take that next step. During times of calm, take every opportunity to build the bond with your child. It's in these quiet moments that you can begin to repair the attachment and develop a healthier relationship. Spend time together doing things they enjoy, engaging in low-pressure activities that allow them to experience positive connection. This is where trust begins to grow, slowly and consistently. But here's the hard truth. There may be times when things are too overwhelming for you to handle on your own. In severe cases, a trained mental health professional is essential. These professionals can guide parents through the difficult process of working with a child who has RAD, providing tools and strategies that are specifically tailored to these kinds of complex trauma-based behaviors. To recap, trust with children who have reactive attachment disorder is built slowly and requires immense patience, understanding, and emotional control. These children are not intentionally trying to push you away. They are responding to deep-seated emotional pain that they don't know how to manage. The key to building trust with them is to remain calm, not take their behavior personally, and offer a consistent, safe place for them to express their pain. Remember, this is a long-term process. It's not about immediate results. It's about showing up day after day, offering love without expectation, and continuing to build that relationship little by little. Thank you for joining us today on the Heart of Connection. If you're a parent or caregiver of a child with RAD, know that you're not alone. Trust is hard-earned, but it's possible. With the right support and guidance, you can help your child heal and form the attachments they've never had. Until next time, take care of yourself, stay patient, and keep showing up.